Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome to the Deep Dive. We take complex subjects, pull out the key info from our research, and we'll give you the expert shortcut you need.
And today, we're tackling a topic that often stays in the shadows, maybe because of embarrassment or shame. Erectile dysfunction, or ED.
Exactly, but we're bringing it into the light.
Because our sources, they really hammer this home.
Yeah.
Understanding ED is fundamentally about understanding your overall physical and emotional health.
That's really our mission for this deep dive. Cut through the stigma, show you that ED, well, it's often a very treatable symptom of something else going on underneath. So we'll define it clearly, link it to those wider health signs, and map out the diagnosis and treatment options available now.
Sounds good. Where do we start? Definition.
Let's do it. So what exactly is ED, technically speaking?
Okay, so the core definition is having consistent difficulty getting an erection or keeping one that's firm enough for, satisfactory sexual activity.
And that word consistent is key, right? It's not about a one-off bad night.
Absolutely crucial. Look, everyone has an occasional issue. Maybe you're stressed, exhausted, had a bit too much to drink. That's normal life.
Sure.
But if it's happening regularly, long-term, that's different. The sources suggest that's a clear flag. Something more structural, maybe medical, maybe psychological, is likely at play.
Okay, and let's bust a couple of myths straight away. This isn't just an inevitable part of getting older, is it?
No, definitely not. Age increases risk, sure, but it's not the direct cause, usually. And it's almost never about a simple lack of desire or attraction.
Right, so it's more mechanical.
It's physiological,
Yeah.
Getting an erection is complex. It involves your brain, hormones, nerves, emotions, and critically, blood flow.
How does that work, basically?
Well, when you're aroused, your brain sends signals, chemical messages, telling the smooth muscles around the blood vessels in the penis to relax.
Relax, to open up.
Exactly. It's called vasodilation. The vessels widen, blood rushes in under pressure, fills the spaces, and that creates the rigidity. ED happens when anything really, messes with that chain of events.
And often, that something is the blood flow itself.
Most often, yes. Some kind of disruption to the blood getting in or staying in.
Okay, got the basics. Now let's talk symptoms. Beyond the obvious difficulty with rigidity, are there other signs people might notice?
Yeah, there can be. Some men report, a general decrease in their interest in sex. Not always, but it happens.
Maybe linked to the anxiety around performance?
Could be. Or sometimes it's dissatisfaction stemming from premature ejaculation finishing sooner than desired, which can feel linked if maintaining the erection is also a struggle. That unreliability just starts to impact the whole experience.
And I imagine that's where the physical problem starts to bleed into the psychological side. If it keeps happening, that must take a toll.
A big toll. And the sources really emphasize this ripple effect. You get frustration, obviously, but then low self-esteem creeps in, embarrassment.
Leading to avoidance.
Often, yes. Avoiding intimacy altogether because the prospect is just too stressful.
Yeah.
And that avoidance, it creates distance in relationships. If it's not talked about openly, you see resentment, poor communication. It really takes root.
So sometimes fixing the ED is step one to fixing the anxiety or depression that follows.
Absolutely. You often have to address both, but sometimes restoring confidence physically opens the door to tackling the emotional side.
Okay, this is where it gets really fascinating for me, the physical causes. This is the core deep dive part, right? Most physical ED points to blood flow issues.
Overwhelmingly, yes. Compromised blood flow, usually related to what doctors call vascular disease.
But just basically problems with the pipes.
Pretty much. Narrowing or blocking of blood vessels, arteries, veins, usually from things like plaque buildup, atherosclerosis.
Okay.
If those vessels are narrowed or stiff, you just can't get enough blood in or it won't stay in under enough pressure or keep a firm erection. The hydraulics don't work right.
And the logic follows. If the tiny blood vessels in the penis are having trouble, bigger vessels elsewhere might be too, or will be soon.
Exactly. That's often an early warning sign. So what specific conditions are really tightly linked?
Yeah, let's list some.
Well, top of the list. High blood pressure, damages vessel walls, affects circulation everywhere.
Right.
Diabetes, this is a big one. High blood sugar is toxic to blood vessel linings, and it damages the nerves needed for arousal signals.
Double impact.
Right. Then there's obesity linked to inflammation, hormone imbalances, Low testosterone levels can play a role, definitely.
And what about treatments for other conditions?
Yeah, treatments for prostate cancer, things like radical surgery to remove the prostate or radiation therapy, these can sometimes damage the nearby nerves and blood vessels crucial for erections. It's often an unavoidable side effect, unfortunately.
This connection, the vascular one, feels like the real aha moment for our listeners. ED isn't just about sex.
Not at all. It's a major health indicator. The sources are so clear on this. Think of it like the canary in the coal mine for your heart.
How so?
The arteries supplying the penis are tiny compared to, say, the coronary arteries feeding your heart muscle.
Much smaller diameter.
Right. So if plaque is starting to build up in your system, it's going to cause noticeable problems in those narrowest vessels first. ED symptoms can show up years, sometimes 3 to 5 years, before someone might experience chest pain or other classic signs of heart disease.
Wow. So getting checked out for ED could literally save your life by catching heart disease early.
It absolutely could. It gives you this crucial window to make lifestyle changes, get on medication if needed, and potentially prevent a heart attack or stroke down the line. It reframes the whole conversation.
Totally. It moves from like a personal issue to a serious medical warning. Okay, so if vessel damage is the hardware, what about the software, the mind? Let's pivot to psychology and lifestyle.
Yeah, the psychological side is huge, and it often mixes in with the physical. Things like stress, anxiety, clinical depression.
Yeah.
They don't just distract you mentally.
They have physical effects.
Definitely. They trigger your sympathetic nervous system, your fight or flight response. When you're in that state, your body diverts blood away from non-essential functions. And from a survival standpoint, getting an erection is pretty non-essential.
So performance anxiety, worrying about whether it will work this time, can actually cause it not to work.
Precisely. It's a vicious cycle. A guy has maybe 1 or 2 bad experiences.
Right.
Then he starts dreading the next time, anticipating failure. That dread ramps up the stress, activates fight or flight, makes the erection less likely, and round it goes.
Makes sense. What else psychologically?
Unresolved relationship problems, simmering tension or anger, that really interferes with the relaxation needed for arousal. Past sexual trauma, too, can have long-lasting impacts.
So risk factors. We mentioned age isn't the direct cause, but risk does go up with age. Why is that?
It's mostly because the conditions linked to ED, vascular disease, diabetes, etc., become more common as we get older. Plus, lifestyle factors accumulate over time.
And what are the big lifestyle culprits?
It's pretty much the standard list for poor cardiovascular health. Smoking is a major one. It really damages blood vessel flexibility.
Right.
A poor diet, especially one high in saturated fats and processed foods, lack of regular exercise, being significantly overweight or obese, leading a very sedentary life.
Alcohol.
Heavy alcohol consumption is definitely strongly linked.
Yeah.
Basically, the same habits that put you at risk for a heart attack are major risk factors for ED.
Okay. Now, you mentioned something earlier. I wanted to circle back to the sleep connection. That seems less obvious.
It's critical and often overlooked. Sleep disorders like chronic insomnia or particularly obstructive sleep apnea have a profound impact.
How?
Well, poor sleep quality is just a massive physical stressor. It messes with your blood pressure, affects overall blood flow regulation,
Yeah.
but maybe even more directly.
Hormones.
Exactly, hormones.
And
Especially testosterone. Healthy sleep, particularly getting enough REM sleep, is vital for normal testosterone production.
And low testosterone affects libido, energy, and erections.
Yes. It affects desire, but also contributes to the physical side of things. When sleep quality is chronically poor, testosterone levels often dip, and that contributes to ED. So if someone's dealing with ED and they're also a terrible sleeper or suspect they have apnea, that needs to be investigated. It's foundational.
Right, you're missing a huge piece of the puzzle otherwise. Okay, so if someone listening recognizes these symptoms, these risk factors, what's the next step? What happens when they talk to a doctor or a urologist?
First step is just open up, being honest. The doctor needs a thorough history. They'll ask about your general health, any medications you're on, existing conditions like diabetes or heart disease.
And specifically about the ED.
Yeah, a detailed sexual history, like when did it start? Is it every time? Only with partner or also alone? Are morning erections still happening? That kind of thing. It helps pinpoint patterns.
Then come the tests.
Usually, yes. Blood tests are pretty standard. They'll check hormone levels, especially testosterone, look for signs of diabetes with blood glucose, check cholesterol, lipids, those vascular risk markers, and definitely check blood pressure.
Any tests specific to erections?
Sometimes. If the cause isn't obvious, they might do more specialized tests, things like Doppler ultrasound, to actually measure blood flow into and out of the penis, often after giving a small injection of a medication to induce an erection right there in the clinic.
Okay, so once there's a diagnosis, or at least the likely cause identified, vascular, hormonal, lifestyle, psychological mix, what's the treatment path look like, starting with the lowest intervention?
Right. You always want to start there if possible. And that's lifestyle changes, what we sometimes call natural reversal.
And this can actually work.
Oh, absolutely. If lifestyle factors are the main driver, these changes can make a huge difference, sometimes completely resolving the issue. We're talking about adopting that heart-healthy diet, getting serious about regular physical activity.
Improves circulation, mood.
Exactly. Quitting smoking is non-negotiable, really. Managing stress, maybe through mindfulness, exercise, whatever works. Getting weight into a healthier range. And tackling those sleep issues we talked about. These are powerful medicines in themselves.
But if lifestyle changes aren't enough, or if the cause is more physical, then we get to the medications people know, like Viagra.
Correct. That's the next step for many. Oral medications like sildenafil, that's Viagra, tadalafil, which is Cialis, and vardenafil, Levitra, they're all in a class called PDE5 inhibitors.
How do they work? In simple terms.
Okay, remember the brain signal tells blood vessels to relax using a chemical messenger.
Yeah.
Well, once an erection is achieved, your body naturally releases an enzyme called PDE5 to break down that relaxation chemical so the erection eventually goes away.
Makes sense.
These drugs, PDE5 inhibitors, they block that enzyme. They inhibit PDE5. By blocking the off-switch enzyme, they allow the relaxation chemical to stick around longer, keeping the vessels dilated, trapping blood in the penis, and sustaining the erection.
They don't create arousal, they just help maintain the physical response once arousal happens.
Precisely. You still need the initial stimulation and arousal. And there's a really crucial caution that comes with these drugs.
Right, the sources emphasize this. What is it?
It's vital.
Yeah.
These medications must only be used under a doctor's supervision. Especially important if you, the listener, are already taking meds for high blood pressure or any heart condition, particularly nitrates like nitroglycerin used for chest pain.
Why nitrates specifically?
Because both PDE5 inhibitors and nitrates lower blood pressure by dilating blood vessels. Taking them together can cause a sudden, really dramatic, and potentially dangerous drop in blood pressure. It's a serious interaction.
Good to know. Okay, so lifestyle, then meds. What if those don't work, or someone can't take them for medical reasons? What are the next options?
Then we move into devices and more advanced, sometimes surgical options. A common non-invasive one is the vacuum erection device. People sometimes call it a penis pump.
How does that work?
It's pretty straightforward. You place a cylinder over the penis, create a vacuum, which physically pulls blood into the penis, creating an erection. Then you slip a snug constriction ring onto the base of the penis to trap the blood and keep it erect after removing the cylinder.
Okay. And if that's not suitable?
For severe cases where nothing else has worked, penile implants are an option. These are medical devices surgically placed entirely inside the body.
What kinds?
There are semi-rigid rods, or more commonly inflatable cylinders placed inside the penis, connected to a small pump usually placed in the scrotum, and a fluid reservoir in the abdomen. Squeezing the pump inflates the cylinders, creating a controlled erection.
That sounds like a permanent solution.
It's generally considered the definitive long-term solution when all other treatments have failed. High satisfaction rates, actually, but it is surgery.
Got it. Now, before we wrap up, we can't forget the emotional side as its own treatment path.
Absolutely not. It's just as important as the physical treatment, often needs to happen in parallel. Talking to a mental health professional, maybe a therapist specializing in sexual health, is key.
Why?
They can help manage that performance anxiety we talked about, address underlying depression or stress, help couples improve communication or work through past trauma, if that's a factor. Treating the mind is crucial so that even when physical function improves, the emotional readiness for intimacy is there too.
Right, makes total sense. Okay, let's synthesize this, the big takeaway for you, the listener. What's the main message here?
I think the main message is ED affects millions of men of all ages. It is incredibly common, and crucially, it is not something to be ashamed of.
And it's treatable.
Very often, yes. Whether the root cause is physical, like a blocked artery signaling wider vascular issues, or emotional, like severe anxiety, or usually some mix, it can often be managed effectively, even fully treated, once you figure out why it's happening.
So seeking help isn't just about sex.
Not at all. It's about taking control of your overall health. It could be vital preventive care for your heart and your long-term well-being.
That's a powerful and hopeful concluding thought. Now, for our final provocative idea, something to mull over. We touched on performance anxiety in the mind. The sources link this back to modern life, specifically media. What's the connection between masturbation, porn, and ED?
Yeah, it's a nuanced point, comes up a lot in therapy. First, the sources are clear. Masturbation itself, normal, healthy, does not cause ED, period.
Okay.
But relying heavily on or having a compulsive relationship with masturbation, especially when it's almost always paired with consuming a lot of online pornography, which is often highly stylized, maybe aggressive, and definitely not realistic.
What can that do?
Well, it may affect a couple of things. One is potential desensitization, meaning real-life partners or situations might seem less stimulating compared to the intense novelty online. And perhaps more significantly, it can set up totally unrealistic expectations about sex, about performance, about how partners should look or act. This can massively feed into performance anxiety during real-life intimacy. It can make achieving arousal or staying focused genuinely harder with a real person.
So it's not the act, but the pattern and the comparison that can cause issues.
Exactly. If someone feels this pattern might be affecting their real-life sexual experiences or causing distress, that's definitely something worth exploring with a doctor or a therapist. It's another piece of that psychological puzzle we've been talking about regaining healthy sexual function and confidence.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.